welcome back. Thank you for staying with us. Amid the uncertainty swirling around the coronavirus pandemic, one indisputable fact remains. The highest rate of fatalities is among older people, particularly those with underlying medical conditions. Medical experts say that if people over 60 are infected, they are more likely to have severe life-threatening complications. Today, we joined adult care officials to gain insight on St. Lucia's current efforts to protect this vulnerable group, the elderly.
Today, we are at the Fair Helen Adult Daycare Center, where we spoke with Director Helen Charles on current mitigation efforts in place to protect the island's most vulnerable population, the elderly, from the dreaded coronavirus. According to Charles, due to the new nature of the strain of the virus, mitigation is an ongoing process.
In as much as it's a new situation or a new health problem, there was nothing that we put in place for that particular health problem. But what we have done, we have met with our executive, and what we are doing right now is to put things in place in terms of working in collaboration with the Ministry of Health and Human Services, so that in the event that an older person is sick, we asking them, the government, so that at least they can send either the doctor or the nurses to take care of them at home instead of taking them to the hospital.
Charles underscored that in relation to the island's dementia and Alzheimer's patients, family members have received special training in terms of preparing them for the virus.
Too many persons are not quite aware of what dementia is all about. This is something that we have done in the past in training caregivers, persons at home, and I am positively sure that the majority of St. Lucians, they know about dementia and Alzheimer's, and they are taking care, because when you are suffering with dementia, you are not aware of what is happening, and the family members, some of them have got the training to know exactly what to do.
Charles underscored the importance of receiving factual information, especially in terms of persons who are caring for elderly individuals in light of the coronavirus outbreak.
I just want to advise all persons that have elderly parents at home is to do not listen to rumors, because there's a lot of that going around, is to make sure you get the proper news from the Ministry of Health, because that is the only news that we're supposed to heed by, because there are so many things that you're hearing. There is 19, there is so many, right? Make sure we listen and get the news straight from the Ministry of Health.
She says across the island, adult care centers are in close discussions with the Ministry of Health to ensure the continued care for the nation's elderly population. For Hot 7 News, I am Jacqueline.
The president of the National Taxi Union is calling out for alternative measures to be put in place for taxi operators amidst COVID-19 preparations. He says the powers that be should have already been briefing people who would be losing business, as well as members of the public, as to the next steps after the closure of the ports.
President of the National Taxi Union, Lucian Joseph, expressed deep concern for St. Lucia's taxi drivers due to COVID-19.
I am deeply concerned about what is happening in St. Lucia now. I believe this thing should never be where it is, although I'm not blaming anybody for the virus or what is happening, but I believe that we were unprepared, and because of this, that all my drivers and everybody now, we have to pay something that we didn't have to pay.
Joseph says that St. Lucia should have followed the footsteps of other Caribbean countries, particularly Barbados, as he believes their Prime Minister exhibited great leadership skills in how she handled the situation, especially in terms of her transparency and communicating of all plans with the nation.
Listen to the Prime Minister from Barbados, her skills and the way she handled that. She handled it beautifully. She says that she has everything in place. She will need to do what she have to do at the second stage.
He says families have to be fed and many people have loans to pay, and neither he nor any of his co-workers have heard of any measures that will be put in place for them during the tough season that may befall them.
I don't see nothing that will help the poor taxi drivers now to pay their loans and to get something going, because everything is shut down. The hotels are closing, the cruise ship is not coming. There is no alternative for 3 months. How many organizations, how many taxi drivers now that can keep their loan back for 3 months? Have they written to the bank? What have they done to help the people? Nothing is happening.
Joseph says he sees lots of decisions being made by people based purely on emotion, and he is pleading with the authorities to put measures in place as he believes chaos awaits taxi drivers as well as other persons directly dependent on the tourism sector. Reporting for Hot 7 News, I am Genevieve Gondra.
Central Statistics will by Friday let St. Lucians know whether the 2020 census will be conducted or cancelled. The office, which falls under the Ministry of Economic Development, Housing, Urban Renewal, Transport and Civil Aviation, asserts that the health and safety of its workers is of paramount importance at this time. Genevieve Gonzague tells us more in this report.
In keeping with international guidelines and the need for social distancing, one of the key pillars of prevention in the management of the COVID-19 pandemic, the St. Lucia Medical and Dental Association strongly recommends that all members, physicians and dentists for a period of at least 2 weeks refrain from providing care to patients within their office spaces and instead utilize the various forms of telecommunication which are widely available for urgent consultation. This course of action is being taken primarily to protect our patients and by extension our community, and to ensure that urgent healthcare needs are addressed, while these seemingly extreme but absolutely necessary measures are implemented. This was the statement by the St. Lucia Medical and Dental Association to its members. The statement incited panic and concern in some quarters and has prompted the president of the St. Lucia Medical and Dental Association, Merle Clark, to verify.
So last evening, after a committee meeting, we at the St. Lucia Medical and Dental Association sent out a press release with the recommendations for our physicians, and dentists as well. And the recommendation essentially was that we practice more telemedicine. Now, why was there a need for that? What is the rationale for the recommendation? Because it certainly seems to have caused quite a bit of consternation, quite a bit of confusion. Doctors' offices have been inundated with calls. So Lucia, let me say right here, right now, that this is not cause for panic. We are never going to abandon you. We are all in this fight against COVID-19 together. The reason we opted to tell our physicians we should try to limit the number of consultations done within a physical structure, a physical space of an office, and to move perhaps more towards telemedicine is to limit the number of patients coming into the office in keeping with the social distancing that we keep hearing about a lot. So what are the pillars in this fight against COVID-19? We need to ensure that we don't have people milling about all the time, because if we have community transmission, then one person can be spreading it to the other.
Clark explained that this move is to serve in the best interest of those most susceptible to the virus.
We just want, essentially, out of abundance of caution, to try to prevent, particularly the patients who are most susceptible, our diabetics, our hypertensive, the patients with COPD, patients with chronic kidney disease, our elderly patients. We want to keep them for now at home.
She clarified what the recommendation telemedicine was and how it would operate.
So essentially, when you call a doctor and say, "Doc, my labs," that sort of thing, and it can be explained to you over the phone, that does not mean that doctors' offices are all just going to simultaneously close and you're not going to be able to see a doctor. Far from it. What we are recommending is you keep your normal appointments. So if you are Dr. Clark's patient, for example, you call for your appointment, or if you had an appointment, you will be contacted and the doctor will guide you as to what to do. So if a patient, we believe, can be seen via, not WhatsApp, because WhatsApp is fairly secure, but there are special apps that we physicians use, and we've been sharing with each other which apps are most secure in terms of doing this for our patients.
Clark says these measures put in place by the association is to ensure both the safety of its members and the public.
The space, and remember, we are trying to protect our general public. If we don't curb this, it's going to overwhelm our already fragile healthcare system, and that is what we're trying to avoid. Moreover, we physicians, particularly in the private sector, what we want is to be able to be available if the call were to come. We have a pending move to the Owen King Area Hospital. Everybody has to be on board for that. If one physician God forbid, were to become ill, somebody has to replace them. So these are the strategies that we are putting in place to ensure that we protect you, the public. Because if every doctor gets sick at the same time, if every doctor is exposed or has to be quarantined, then we have a problem. Because right now we can't count on our friendly nations as much. Cuba is going to help, and Taiwan is going to help. But everybody does have their own issues because this is a pandemic, and we have to be aware of that we have to be able to help ourselves.
The St. Lucia Medical and Dental Association fully support the decisions by the police to curb social activities, as they believe now is the time to come together to ensure that the virus is contained and fight COVID-19. Reporting for Hot 7 News, I am Genevieve Gonzague.
The government of St. Lucia has announced that Thursday, the 19th of March, will be a national day of prayer. As a Christian nation, the government says this is an ideal time to come together for prayer and reflection, albeit not in a physical space. Our cameras took to the streets speaking to members of the public to find out whether they will be participating in the National Day of Prayer and whether prayer is the answer.
Today we took to the streets of Castries to find out if you, members of the public, will be taking part in the National Day of Prayer tomorrow.
No, I'm not taking part in that because I pray at my home every day and night.
Online?
It's online, it's on the radio, it's just to get everybody involved in praying for the nation for grace and mercy dealing with coronavirus.
Yes. Yeah. I agree to the National Day of Prayer. I hope to follow it on the radio, on the TV. And I'm asking God to bless us, deliver us from all evils and dangers of that virus. And also the people who live in the rest of the world. We all have families in America, Canada, and so on. So Jesus, have mercy on us and deliver us from that dreadful disease.
Well, one thing I do know is that from a Christian standpoint of view, I do know that God answers prayers. Not forgetting that we have to exercise wisdom, because of the coronavirus. We must take all precautionary measures. But if there is a time for us to pray as a team, as a church, I think it's a very good idea. The Bible declares that one will put 1,000 to flight, two will put 10,000. So, and again, we mustn't only wait for when it's crisis for us to pray, we have to pray very often. But I'll support the prayer session. Thanks very much.
Yes.
Yes, but what happened, I have not followed it because I know I'm not a great lover of television watching this, of course. It's a situation, of course, but I do watch television all the time. But if there is a thing, I think I'll be watching.
National Day of Prayer? No, man, me not on that at all. Because let me make you understand something. Prayers, I always know God dwells within living things. So I don't have no God in the sky. So all those who want to go and pray for their God in the sky is up to them. But God dwells within mankind. Okay? So my prayers, when I pray within myself because I feel in it. When I pray, nobody doesn't answer me. I feel it within me. So I know my conscience is my God. You understand? So anything I do bad, after when I go by myself, my conscience hitting me, so I know it's my God talking to me. So I'm not looking for no God in the sky. I'm not praying for no God in the sky. I am not a European. You understand? So I'm out of that. And remember Bob Marley had sing that song. Many more will have to suffer. Many more will have to die. But don't ask him why. You understand? Because man himself, towards man himself, them man are poison. Because them man trying to destroy the whole nation. And it's more black people like ourselves they're trying to destroy. But right now they're destroying their own self.
Definitely. I am somebody who really believes that St. Lucia needs Christ now. I believe that our people have turned away from the good way, but at the same time, some divine intervention is needed, especially with this coronavirus that is not only wrecking St. Lucia and the Caribbean, but the world at large. We know that we have heard of 2 cases. Maybe there may be more. I've heard of other people getting sick. I do hope that this day of prayer will bring St. Lucians to the realization that we have to change our habits, we have to change the way we think, we have to change the way we do things, and we have to follow instructions. I was reading online how some people are saying, why a day of prayer now? I think people are a bit absurd, if I have to say that way, that they do not realize that, there is somebody greater than us, and there is something greater than us that we need to rely on.
Well, hopefully I will, because when it comes to prayers, it's very, very important in St. Lucia as a pastor. Because right now we need a lot of prayers with the virus that's going on. We know that the government is doing the best to put things in place. We just have to put the politics and everything else aside and just concentrate on trying to save lives. Because right now, this virus right now is becoming like an epidemic elsewhere. It's not really an epidemic in St. Lucia, but we do have some people are panicking. And I just wanted to say to the people of St. Lucia, do not panic. Put your faith in God. That's the only way out is Jesus Christ. Just put your faith and just continue to praise God and pray for one another. Love one another. We know the virus is there. Maybe one or two people maybe have it. Well, let us just pray that God will put a hand. And let us do what's right to help the government, help the people, and let us just pray and embrace one another. Because this virus is not a joke. The virus is very, very serious. I want to say to the people of St. Lucia, the government are trying the best they can.
As we come together tomorrow to ask for guidance and mercy in dealing with the dreaded coronavirus, I am Jacka Wooding signing out for Hot 7 TV. We are asking you to join our sister station, Kiss FM, Hot FM, as well as joining us here on Hot 7 TV for full coverage of the festivities tomorrow.
This is the Hot 7 TV Nightly News. Stay with us. There's more coming up after the break.